Good afternoon, everyone. My name is Diego Portillo Masal. I'm the director of the Inner City Capital Connections program. And on behalf of ICIC, I'd like to welcome and thank you all for logging in to this town hall discussion about the important role of COVID-19 vaccinations and what it plays in safely returning to normalcy and helping small businesses recover from the economic impact of the pandemic. Throughout the last year and more, ICIC has worked to compile and share information and resources with our network of small businesses to provide additional support through this unprecedented time. We're particularly thankful to Kaiser Permanente, our longtime partner on our ICIC program, for connecting us with Health Action Alliance, a group that is working to strengthen the business community response to COVID-19 by providing information, tools, and training to encourage vaccination and improve public health. I'd like to give a couple of shout outs to all the other members of the ICIC team involved in this effort. Our Western Regional Manager, Anna Marie Cruz, our Director of Communication, Brett Bresnahan, our Director of Development, Liz Pugh, the orchestrator of this event, Callan Small. Want to also acknowledge Sonia Moyne, our Senior Director of Urban Business Initiatives, and our CEO, Steve Grossman. And then in addition, want to give one shout out to Brittany Giles-Cantrell of the Beaumont Foundation for helping begin this discussion and this connection. I will, in a moment, hand over the mic to Stephen Massey of the Health Action Alliance. But before that, I'm going to ask my colleague, Callan Small, to lead us in a little bit of intro with everybody in the room. So, Callan.
I actually don't have the question in front of me. Liz, I'm going to pass the baton to you.
All right.
Not a problem. And so we're really glad to have everyone with us. And just to start things off, we'd love for a few folks in the room to introduce themselves briefly, who you are, what your business or organization is, and one or two goals or things you'd like to learn from today's session, and that will help Stephen guide the conversation. So we'll ask, anyone, you can either use the raise hands function or just unmute yourself and come on camera to introduce yourself.
Liz, I'm gonna hijack that a little bit and we'll go popcorn style, since I don't see a lot of people willing to be the first to introduce themselves. So I'm gonna call on General Churn to be the first to introduce himself. Brittany, I know you have to pop off pretty soon, so why don't we have you introduce yourself first?
Thanks so much, Diego. Happy to. And thanks everyone for joining. My name is Brittany Giles-Cantrell. I'm with the Beaumont Foundation. If you're not familiar with us, we're a national public health philanthropy located in Bethesda, Maryland. So I'm coming to you from Washington, D.C. For everyone who might be on the East Coast. And we're here really because the Beaumont Foundation is one of the founding partners of the Health Action Alliance, which Stephen will get into a lot more in the call, but just wanted to say that, as a public health foundation, the reason we're in this is because, one, we see health as being vital to our economy. And so to support businesses of all sizes is part of our mission, and to help create tools and resources to support your longevity and to build wealth in the communities that we serve. So just want to thank you all for all of the great work that you do. And so I can't join for the entire call, but just hoping this is a helpful discussion for you all if you're thinking about, safe reopenings and the future of your work and your workforce. And so just really looking forward to learning what your concerns are and how we can be of, even more support to you in the future. So thanks.
I want to make sure we hear from some of our participants. So Lynn Herring, Want to call you out? Are you with us?
Yes, I'm here. Thank you. My name is Lynn, and I own a staffing firm. And the reason I'm attending today's event is because I am working with several candidates who are employed under our company but contracted to our clients. So I want to make sure that I'm doing or following the right protocols as far as, you know, what happens when they do call in with, say, you know, a positive COVID test result, that sort of thing.
Lynn, can I just ask you, what part of the country are you joining us from?
I'm calling from Honolulu, Hawaii.
Great. And General Chern, welcome.
Thank you.
See you on camera now, so I'm going to ask you to introduce yourself.
Hello, good afternoon, everyone. My name is Major General Retired Philip Chern, retired after 37 years of military service. I am also the president of Syzygy International, a security and risk management company, and I'm also the president of the Retired Military Officers Business Association. Good to see you all. Thank
And
you.
let me just add, Diego, that General Chern, who became aware of our programs last year, was one of our most prolific nominating partners last year and has the distinction of being the person who has nominated more veteran-owned small businesses than anybody else in the history of the Inter-City Capital Connections program. And now that I've called you out, General, and given you a shout out, we know that you're going to nominate lots more businesses later this year, but thank you so much for your leadership.
We're going to have to double that effort then. Okay, well, thank you. I will take that on as a personal task to double my efforts. Thank you.
Thanks, General.
Sharonica, are you with us?
Hi, yes, I am. I'm actually driving, so I have you guys hands-free. So I just joined a little bit tardy. My apologies.
No, we're just doing a quick round of introductions. So please tell us a little bit about your business and anything you're hoping to hear from at this town hall.
For sure. Thank you. My name is Sharonica Barcliffe. I'm the CEO and founder of the Barcliffe Group Incorporated. We are a healthcare quality and equity company headquartered right here in Atlanta, Georgia. Coming up in June will be 7 years. And we're hoping just to, you know, be steadfast in our brand promise to our clients and our community in terms of vaccine readiness, COVID readiness, and anything that we could help add to our brand promise, which is excellence without exception.
Fantastic. Thank you. Ronette, are you with us?
Yes, I'm here. How are you?
Doing well.
Hi, I'm Ronette Myers. I'm the president and CEO of J-Land Solutions. We're a woman-owned government contracting firm located in the District of Columbia. We specialize in professional services and information technology support services to the federal, state, and local government. So we're 8A, HUBZone, woman-owned. And so we have a return to work committee that is putting together policies and procedures on when we return to work. So I'm anxious to hear more about, can we mandate vaccines of our employees? What are the best practices on bringing them back together since we haven't seen each other? Well, when COVID started, I had 9 employees. Now I have almost 40. So I've never met a lot of these people. So it's going to be interesting going back into the workplace. So thank you. And I look forward to hearing more.
Thank you, Ronette. Annette.
Good morning. I had my video off for a while. I was eating breakfast here in Maui, Hawaii. Nice to see I'm not the only one calling in from Hawaii at just around 7:07 in the morning. I'm with Maui Economic Development Board, and we have partnered with ICIC for a couple of years now to help small businesses on particularly Maui to initially to expand and grow, and with this pandemic to survive and to pivot and we're looking at happy to continue that partnership. And I'm here really to listen and hear. I'm very interested to hear, what both from, what rights and responsibilities we have as an organization to, as we start looking at returning to, we're looking at being back in the office in July, but also helping other small businesses, and if they're seeking advice.
Maybe you can convince Stephen Massey from the Health Action Alliance, instead of, because he lives in Portland, Oregon, instead of traveling all the way east to Provincetown for his vacation, maybe you convince him to get on a plane and come to Maui, because I know Maui needs the tourism badly.
Well, it definitely has picked up the last couple of months. There's no shortage of people wanting to come to Maui to escape the mainland. So it really has picked up. So it's been a big help. And the big key is doing that safely, and it seems to be working. But yeah, you're very welcome, Stephen. Look us up.
Hey, I know there are 3 nonstops a day from Portland to Maui, so I know that much. So I'd love to come.
Lana?
Hi, I am sitting in for my boss, Roger Matthews. We have a small minority-owned construction business in Boston, and I'm the office manager, and I'm just here to listen, learn, just like what everyone is saying, what are the best practices for having people be vaccinated, like my boss and I, we are, some of his employees are not, and you mandate vaccines. So again, just to hear and learn, what you guys have to say, and are these things that we can, of course, put in our employee handbook.
Fantastic. We are going to have an opportunity to go back to networking after speaking with Stephen and the Q&A. So if I didn't get to you, please don't feel left out. And I know we will more than likely have a few more people pop in as we get going, but we'll turn it right over to Stephen Massey. Hopefully he was taking notes, as I saw during some of your questions, so it'll be a great opportunity for conversation. But if you have additional things you'd like to hear about, please drop them in the chat box, and I'll try to make sure that I would read them out to Stephen.
Great. Well, listen, thank you so much, Diego, for the invitation to be here today. Also to Steve Grossman and to Liz for inviting me and organizing today's session. I'm thrilled to be speaking with so many small business owners beyond coast to coast. Great to be connected with the folks joining us from Hawaii as well. And I'm excited to share with you some of the great tools, resources, and best practices that will help you navigate the path forward as you begin to consider reopening or create policies to strengthen vaccination and workplace safety within your small business. First, let me tell you a little bit about the Health Action Alliance. We are a relatively young organization that was designed to help unlock the power of business, large and small, to help accelerate the COVID-19 response, strengthen vaccine acceptance, and rebuild public health. We were informed and created by top experts in public health, communications, and business management, and founded by the Ad Council, the Business Roundtable, the CDC Foundation, the de Beaumont Foundation, and the Robert Wood Johnson Foundation. And the team at Meteorite, which is a small business that I run, manages the operations of this organization day to day. Want to just also thank and acknowledge Brittany from the de Beaumont Foundation, who is on today's call. It was 14 months ago today that the World Health Organization declared COVID-19 a global pandemic. And what a devastating year it has been, with more than 32 million Americans infected with COVID-19 and nearly 580,000 deaths in the United States from the virus. Many of us have lost family members or friends to COVID-19. Some of us, including myself, has been infected with COVID-19. And if you've lost a family member or a friend or suffered personally, I want to just extend my deep condolences to you. And also thank you for being here today, for standing up, and for saying that you are committed to getting Americans vaccinated against this deadly virus. Vaccines are the path forward. And so it's going to take all of us, large and small business, partnering with public health organizations, the government, faith leaders, community organizations, to work together to vaccinate enough Americans to help stem the spread of COVID-19. And of course, there is hope. A historic vaccine rollout is already underway. But it's important to remember that vaccines alone, though they are miracles, they don't save lives. Vaccinations save lives. And so that's why businesses large and small are working together to accelerate the pace of vaccinations. And the good news is that vaccinations are happening at a much quicker pace than many public health experts expected at the beginning of the year. Already 58% of US adults have been vaccinated with at least one dose of the COVID-19 vaccines, and almost 45% of US adults are fully vaccinated. Again, that's tremendous progress forward. The White House has established a new goal to reach 70% of US adults with at least one vaccine dosed by July 4th. Roughly 36 million additional adults will need to get a first dose in the next 2 months. So we do have a long ways to go. More good news. Vaccine confidence in the United States is growing, and it's growing quickly. This is the latest survey data taken just a few weeks ago by the Washington Post and ABC News. And what we see here is that 63% of US adults say that they intend to get vaccinated or already have begun the process. And another 11% of US adults are saying that they're probably going to get vaccinated. 8% are saying probably no, and 16% are firmly planted in the no column. Reaching 70% of adult vaccinations then is achievable if we are able to build vaccine confidence amongst those who are in the probably category, and then make sure that those who intend to get vaccinated can fulfill in that intention by making it easier for them to access vaccines and get those shots. There's also more good news about confidence across racial and ethnic groups. In January, we saw more disparities and less confidence amongst whites, blacks, Hispanics, and Republicans. Today, we're seeing growing confidence amongst these population groups. In fact, now over 80% of Hispanics say they are ready to get vaccinated. But what this data does not share is that there are stark disparities in access that remain. This is a map of East Baton Rouge Parish in Louisiana, and each of these round dots represents a COVID-19 vaccination site. The communities that represent communities with higher rates of people of color are those shaded red. And so you can see that there are fewer COVID-19 vaccine sites in communities of color compared to communities that are largely white populations. This signals that many communities don't have vaccination sites in those areas that have been disproportionately impacted by the virus. You'll see here on this slide that this is reflected in the rates of vaccination by racial and ethnic group. The percentage of US residents who have received at least one dose of a COVID-19 vaccine by race and ethnicity, there's wide differences here. Only 24% of Black Americans have received their first shot, whereas 39% of white Americans and 50% of Asian Americans have done so. So again, access is the issue here. We also know that partisanship and age are two critical factors that shape vaccine hesitancy. This slide suggests that just 10% of Democrats right now are saying that they will not get vaccinated, but Republicans, 40% of Republicans are saying that they are unlikely or will not get vaccinated. And it's especially problematic for young Republicans aged 18 to 39. So in January, you saw pictures like this on the left of Dodger Stadium in Los Angeles with cars lined up to get vaccinated. And here's a shot taken this week of the same location, Dodger Stadium, far fewer cars. And we see that there are the demand for vaccines is beginning to wane. As small business owners, you're also navigating what is going to be a complex patchwork of reopenings across the country. This map, which was published in yesterday's New York Times, shows the states that are already open, fully reopened, shaded in dark blue, States that will reopen in May are in that medium blue, and then states along the West Coast and in the Mid-Atlantic region, as well as in the Northeast, that are waiting to June or later to reopen. So for employers that operate in some of these states that haven't yet reopened, you're navigating a kind of a reopening timeline. Gartner has done some great survey work with employers to help understand when they expect to reopen physical offices. And about 45% of businesses are saying that they expect to reopen in Q3. And an additional 24% of businesses are saying that they're likely to reopen in Q4. So about 80% of the country will reopen this year, workplaces to their employees. And so many employers are considering ways and strategies to make sure that their employees are protected as they come back into the office setting. One of the reasons that I'm really excited to have this conversation with all of you today is because we know that businesses play a really important role in American society as trusted messengers of public health information. In fact, according to this Edelman Trust Barometer, 72% of Americans trust their employer more than any other institution. And 73% of Americans want to work for a business that protects their employees during the pandemic. So that's why we're here, because together we really believe that we can create a stronger and healthier future for everyone in America. And we like to think of there are 4 ways that employers can help strengthen vaccination for employees. So first is to remove barriers to vaccination and make it easier for your employees to get vaccinated when it's their turn. Businesses can also educate workers and about the benefits of vaccines, about the safety and efficacy of vaccines, and about where they can get vaccinated. Businesses can engage workforce populations that may have unique questions or concerns about vaccines. And businesses can partner with community organizations to help accelerate the pace of community vaccinations. At the Health Action Alliance, we've created a small business guide to help small businesses create vaccination programs, policies, and plans. And we'll make sure to share our guide with you at the end of today's session. I'm going to summarize some of the key points over the next 15 minutes or so. So first, let me talk a bit more about removing barriers to vaccination. With about 58% of adults already vaccinated, what we're trying to do is trying to reach those Americans, adults, who are still in what we call the movable middle. Those who are considering getting vaccinated but haven't made up their mind yet. And there are lots of reasons why people have not yet made up their mind. In many cases, it's because they don't have the flexibility in their work schedules to be able to access vaccine appointments or take time off of work. And so vaccines themselves are being provided for free by the federal government, but the federal government is asking small employers to consider offering paid time off for employees to schedule their vaccine appointments and to provide paid leave for recovery from potential side effects. The Biden administration has in fact announced a new federal tax credit that makes it easy for small businesses to offer paid time off for employees who want to schedule their vaccine appointments or for recovery. This tax credit fully reimburses small businesses with fewer than 500 employees for any paid time off that they offer for vaccines. Small businesses can also cover out-of-pocket expenses or offer modest financial incentives. And for businesses that operate in rural communities or have employees that might need some language support, you might want to consider offering internet access or language support for scheduling appointments. And for medium-sized businesses or businesses that have relationships with local public health departments or providers, consider hosting an on-site vaccination clinic to help your employees get vaccinated. Now, at the beginning of today's session, one of our attendees asked about whether or not your company should require some of your workforce to get vaccinated. What we know is that the federal government has said that, in fact, it is legal to require vaccinations, and that there are lots of exemptions that you'll need to make sure are offered for employees who have protected classes of exemptions for religious, medical, or other reasons. So for small businesses, navigating the complex legal issues around mandates may be more than you're willing to take on. what I would recommend first, before you do anything, is to seek the advice of legal counsel to help you understand what protocols would need to be in place, how you would handle privacy and data, and how you will manage and deal with those exemptions for employees with protected exemptions for religious or health reasons. You'll also need to make reasonable accommodations for employees that do have exemptions. And so that is something that you'll need to build into your vaccine plan. Another question that we get often is, will my company or business continue to require masking, distancing, and other preventive measures, even as my states are lifting mask mandates and other restrictions? Well, what we know today is that the CDC recommends wearing masks in workplaces and other public settings, at events and gatherings, and anywhere individuals will be around other people. So in office buildings, for example. Masks are still required on planes, buses, trains, and other forms of public transportation. So we encourage you to closely monitor and follow CDC's public health and prevention guidelines. OSHA has not yet issued guidance on this topic, and we are expecting guidance from OSHA soon. We know that as more Americans get the vaccine, the federal government is likely to ease some of the recommendations. And yet, we encourage you to sort of keep track of those recommendations and the guidance from CDC in the weeks and months ahead. What we do also know is that for those Americans who are still in that middle, some of the convenience and incentive strategies that I mentioned earlier really can move the needle. Among employees, for example, who are still undecided about vaccine, 37% of them said that they'd be more likely to get vaccinated if their employer would arrange for an on-site vaccination. And another 30% said that they would consider getting vaccinated if their employer offered a $50 incentive. Right now, employers aren't doing as much as their employees are hoping in the area of vaccine support. This study was taken just a few weeks ago by McKinsey, where they invited employees and CEOs at a number of medium and large-sized businesses to reply to a survey about what sorts of policies are in place to support and encourage employee vaccination. Just 34% of employers right now are offering PTO for vaccination recovery, whereas 85% of employees want that benefit. Only 4% of employers right now are offering support to help employees schedule their vaccine appointments. And yet 83% of employees who are still undecided are asking for that. And covering employee transportation costs, just 2% of the companies are doing that right now, whereas 77% of employees want that. And I know some of you are asking about how you can share information with employees. Well, hosting an employee town hall and sharing vaccine facts, just 1 in 5 employers is doing that right now, whereas 80% of employees would like that.
Stephen, before you move on, just 2 quick questions. One was this all employees or employees who were undecided about the vaccine? I think you said both.
Yeah, I believe that was employees who were still undecided about the vaccine.
Okay. And then, do you know how an employer would offer on-site vaccinations? Are there companies that offer this service, or who would you be contacting?
Yeah, great question, Diego. I really appreciate that one. So the vaccine distribution is being managed at the state level. So every state public health department has its own guidelines for who and how can administer vaccines. Most states are encouraging or incentivizing businesses to partner with either the state public health department or a third-party licensed provider in that state. So in many states, that'll be like a CVS or a Walmart or a Target or a Walgreens or another provider, pharmacy that will come to your work site and administer those shots. Again, in most places, the cost for that service is being covered either by the federal government or by the state. If you live in a state where the local health department is not working with businesses, then you can contact, again, one of these third-party providers and arrange time slots for your employees to go to a local Walgreens or CVS to get their vaccine shots.
Diego, Phil, I have a question for Stephen. Stephen, I like what you're saying, but one thought comes to my mind. As we talk about incentivizing our employees to take a shot or help them with transportation, do you foresee us or employers, especially small businesses, opening up a Pandora's box in which employees say, well, you incentivized me for this. Now something else comes up. I want to be incentivized for that. Do you see that as, knocking on Pandora's box, opening up Pandora's box? How would you respond to that for small business owners? Thanks.
Yeah, Major General Stern, thank you so much for that question. And also thank you for your 37 years of service to our country. We're deeply grateful. It's a great question. We've heard it before. And I think that the way that we're advising companies is to think about the incentive as offsetting costs associated with getting vaccinated. In some places, getting to and from a vaccine appointment requires travel time, requires, if you don't have transportation yourself, it's taking public transportation or getting an Uber or a Lyft. Both Uber and Lyft are offering free or discounted rides to vaccine sites, particularly for disproportionately impacted communities. So that's how I like to think about incentives. There are some companies that are offering as much as $500 incentives for their employees to get vaccinated. And while I'd love to work at one of those companies, I think it signals that we have to essentially pay people to get a vaccine that we know is safe and effective and will help save their lives and protect the lives of those around them. So I would encourage any company that is considering incentives to really think about modest incentives in that sort of $30 to $50 range, and talk about that as incentive as helping to offset costs associated with vaccinations, getting a meal, covering your daycare for your child if you're a parent and you need to go to the vaccine site. Again, most sites aren't allowing you to bring your children. So, finding childcare for a child, that can be covered through that incentive. We do know that modest incentives work. That last slide signaled that 30% of those who are unvaccinated would consider getting vaccinated with a modest financial incentive of just $50. So I think that is the range that we would recommend. Great. I think not every company is going to be able to offer all of these great incentives and strategies. So I like to think about your vaccine policy on a continuum. So the good thing to do is to promote vaccination by providing your workforce with educational materials and public health guidance. A better policy is to offer paid time off for vaccination and recovering from side effects. And the best strategy, of course, is to make sure that all of your eligible workers have access to vaccines on site at your place of business. So once you've created your vaccine policy and plan, another important strategy really is to educate workers about vaccine safety and efficacy. And as small business owners, you have really personal relationships with all of your employees, I would imagine, or many of your employees directly. And so face-to-face or Zoom-to-Zoom communication, sharing your own personal experience of getting vaccinated or your commitment to getting vaccinated is really important. You can also schedule vaccine education sessions with local public health experts or local physicians. Consider a staff meeting or a town hall for employees at your company. Invite leaders within your company or trusted messengers on your team to share about their experience getting vaccinated and what that has unlocked for them. Maybe that's moments of connection with their friends and family. Maybe they've been able to go to the ballpark and attend a game or organize a picnic, for Mother's Day. Those types of moments that kind of create a personal connection to the benefits of vaccination, we know make a big difference. We also have a range of PSAs and in-store radio announcements and other types of workplace flyers and advertisements that are available on our website that you can use to educate your workers. There are 6 messages that we are encouraging small businesses to share with their employees. The first and most important really is that COVID-19 vaccines can help us get back to the things we love, those moments we miss with our family and our friends. and that vaccines themselves are safe and effective. They protect you, but they also protect the people that you love in your life. This third message, get vaccinated as soon as it's your turn. Well, it's now everybody's turn to get vaccinated. All adults in the United States are now eligible for vaccines, and very soon, children will be eligible. And so sharing that information with people who still don't know that every adult in the United States is eligible for vaccines is an important message to share. Coming very soon, literally in the next couple of weeks, across most pharmacies in America, anyone will be able to walk in and get a vaccine shot. Which vaccine should you get? Well, you should get the one that's offered to you. All 3 vaccines have been approved by the FDA as safe and effective. Of course, the Johnson & Johnson vaccine was put on pause for a week after it had been released due to some concerns about a few cases of blood clots. That vaccine is now again approved for use, and your employees that have questions about the vaccine that's right for them should speak to their doctor. For now, COVID vaccines provide hope, but we do have to keep wearing our masks and distancing to protect each other and stop the spread. And finally, it's okay for employees in your company and for your customers to have questions about vaccines. This is a personal decision. This is a personal choice, and it's normal to have questions. Your role as a business leader is to help make sure that your employees have access to resources to answer their questions. When you're communicating about vaccines, it's important to lead with empathy. Just as I started today's presentation talking about my own experience with COVID-19 and the loss that I experienced in my family, many of your employees are going to have a connection to COVID-19 through personal loss or suffering. And so start there. That's where employees are when they think about COVID-19. And there's all the other burdens that many Americans have experienced this last year: loss of jobs, increased uncertainty, mental health challenges, isolation, depression. So starting from a place of empathy with all of your employees, whether or not they've been vaccinated or intend to get vaccinated, is really key. It's also important to listen more than you speak. This isn't about a debate or trying to convince anyone to get vaccinated. It's about listening to their concerns and questions and then connecting them to answers from trusted sources. Facts about safety are key, but it's important to, again, think about those emotional triggers, those moments of connection that are created once you get vaccinated, and find ways to celebrate and normalize getting vaccinated. It's important to stay away from politics or political overtones. As I mentioned earlier, a larger share of Republicans right now are refusing vaccination. And the reasons that they're giving is that they felt that the pandemic was politicized. And so what we know about Republican voters who've chosen to not get vaccinated is that messages from public health officials and from local business leaders are the most trusted right now and the most convincing in moving them from no or probably not to the yes column. You should expect questions, of course, and listen and provide a mechanism for feedback. Remember that messengers matter, and find the right person to have the conversation with your employees. And finally, some of your employees may choose not to get vaccinated. So you'll want to make sure you create a safe space for them so that they feel welcome at your place of business. Third, it's important to engage and support disproportionately impacted populations. This includes, of course, older Americans that might be part of your workforce, as well as workers who might represent communities such as African American, Hispanic, Native American, Alaska Native, and other communities that have been disproportionately impacted by COVID-19. We offer a vaccine education program for employee resource groups and diversity professionals. And you're welcome to extend an invitation to diverse leaders on your team who might want tips and tools to share vaccine facts and improve access for communities of color and other disproportionately impacted populations. You can register for this program on our website at healthaction.org/events, and you'll find all of our great tools for diverse communities there. And then finally, lots of small businesses are asking how they can help support and strengthen community vaccination by offering, for example, PTO to employees who might volunteer at a mass vaccination site, or offer logistical support, or even empty office space as vaccine sites. And we're seeing many small businesses across the country do that. Today, the Health Action Alliance, in partnership with the National Safety Council, also just released a new guide for safe returns to work. I'm not going to detail all of this here because I want to stay focused on vaccines, but you can find our new guidance on safe reopenings on our website, as well at healthaction.org/resources. That includes a toolkit for business leaders, as well as a tip sheet for safer workplace returns. Before I close and open to some questions, I wanted to share some examples of medium and small size companies that are doing really great work on vaccination. I'm sharing these examples, I hope, as an inspiration to folks on this call, ways that you might consider implementing similar strategies at your company. So Chobani, my favorite yogurt maker, is offering 6 hours of paid time off to employees to get vaccines. And they're also working with public health officials to help on-site vaccination clinics. They've helped about 3,000 of their employees get vaccinated. Cargo Transporters is a trucking company, and they're also hosting on-site vaccination clinics for drivers twice a week at truck stops. Up and Down Milwaukee is offering game tokens to anyone who gets vaccinated. All you need to do is show your vaccine card, and a small business in Milwaukee is offering free game tokens to play at their arcade. Farm 406, it's a pharmacy based up in Billings, Montana. They're partnering with a local coffee company, Mazevo. Get a vaccine, get a free cup of coffee. All you need to do is show your vaccine card and you'll get a cup of coffee. I believe that promotion runs all year long. Stop and Shop, one of my favorite grocers up in the Northeast, is providing free fresh meals to staff at mass vaccination sites in the market it serves. That includes at Fenway Park, and Gillette Stadium up in Massachusetts, where I know a lot of the ICIC team is, as well as the Meadowlands Sports Complex in New Jersey. Oak and Reel is a Detroit restaurant, and they're offering vaccinated customers a 50% off coupon to come back and dine at their restaurants. And Zippy's, a Hawaii-based chain, and I did not know, I promise I did not know that we were going to have Hawaii folks on today's call, but Zippy's, and you all in Hawaii probably know this, they're offering digital tokens to their workers that can be redeemed for paid time off if they choose to get vaccinated. And then finally, I think this is my last one, FloraCraft is partnering with the Mason County Health Department to hold small vaccine clinics where it's been administering about 50 doses to workers and their families. And FloraCraft is providing a $50 incentive for each employee that receives the shot. So with that, I'm going to open it up for some questions and answers. And just to kind of get the conversation going, I'd love to field any questions that you have about the content that I shared, or what you may have learned today to support employees at your place of business. Maybe you have a best practice that you'd like to share with this group. So I'd love to invite those as well. And if there's anything that you've learned today that you're going to go back into your business and implement, I'd certainly love to hear that from you too. So again, thanks to the ICIC team for having me here. And I think we have about 15 minutes for questions.
So Stephen, one of the questions that came in while you were talking was this balance between, you talked about values of the organization right at the very beginning, and then sort of opening the possibility of your employees not getting vaccinated for all kinds of reasons and having those spaces. So if you're, as an organization, trying to project the value of the importance of vaccination, how do you balance this with having to keep and maintain those spaces open for people making the choice not to?
Yeah, that's a great question. For most employers, they think about their values as being employee-centered companies, right? They really care about their employees, their customers, and the communities in which they operate. And so most employers are, when they think about their values, they've decided that includes choice and the freedom of choice around getting vaccinated. And what they're going to do is do everything they can to share vaccine facts, answer questions, and reduce barriers to vaccination. So for most employers, that's how they've aligned their values with the work that they're doing to educate and engage and encourage vaccinations. a smaller number, and it's just a couple, 2 to 3% of employers in the United States right now are mandating vaccines. And there's many reasons, as I said earlier. The legal issues around mandates are very complicated. But for most employers, it's about their values. That mandating a vaccine isn't something that really aligns with their values. That may shift over time. When vaccines weren't available to everyone, employers were really reticent to issue mask mandates. You've heard more recently the CDC and others say that we may never reach herd immunity in this country, which will present a longer problem, make COVID a long-term disease that we will have to manage going forward. And managing managing COVID-19 over the long term will cost employers. And so some companies may choose to shift their policy and require some or all of their workers to get mandated and may get those vaccines in the coming months. But I think this is a moving target, Diego, and one where what we haven't seen yet, many businesses take that step.
Annette, you had a question.
I do. I'm just curious about the Health Privacy Act, and if that's causing any issues with people either saying that that they'd rather not say whether they've been vaccinated or not, or employers feeling that they can't ask the question of whether they've been vaccinated.
Yeah, so what we know is that according to the EEOP, employers can ask their employees whether or not they've been vaccinated. What they can't do is ask any follow-up question. So if an employee says to you, I'm not vaccinated, you can't ask them why. And if they are vaccinated, you can invite them to share why they chose to get vaccinated. But you can't keep a record of those reasons, particularly for those who have not been vaccinated. I'm also going to just admit I am not a lawyer, and I would not trust my own legal advice. So I encourage anybody that is thinking about tracking compliance or vaccination amongst employees to make sure that you reach out to your legal counsel or a lawyer friend or somebody who can advise you on that regard. We also offer guidance in our resources about that. So I put the link to our general resources in the chat. We have specific resources that we've developed for small businesses. So I'll also drop that link in the chat so that you'll be able to access those and use those materials.
Thank you.
Stephen, one of the questions that came in was, have you had any updates on this concept that we're going to need booster shots in the fall?
Yeah, I was actually just on a call with the CDC and where they answered that question. I think we are in a wait and see mode. We just don't yet know enough about the way that these vaccines are going to work in the real world as the virus mutates and as more of the population gets vaccinated. I think previously public health officials felt that if we were able to reach herd immunity, that may essentially remove enough people within the population in the United States where it would be unlikely or more difficult for the virus to spread. And so that booster shots may not be required. If we don't reach that threshold, or if the virus mutates, then it may be that, like the flu, each year Americans will be encouraged to get a booster shot. So more to come on this. I think we're going to learn over the coming months how these vaccines play out in the real world.
Any other questions? If not, we'll go back to.
Yeah, I would actually love to ask a question of anybody here that has implemented kind of outreach to employees at your company that have been particularly effective, or strategies that you've heard that have really worked. I'm always collecting best practices and would just love to invite any suggestions that or tips that I might be able to share with others.
Question here about whether you can ask employees to see their vaccine sheet.
I'm not sure about that. I'm not sure if that is allowed, and I can get back to you on that.
Kind of a follow-up or similar.
what I do know is that in some states, and the reason I'm hedging on this is because there's been legislation passed or executive orders signed by mostly Republican governors who have made it illegal for some employers to require proof of vaccination for customers. I'm not sure if that extends to employees as well. And if it does, then that means that there is a discrepancy between state guidance and federal guidance, which is not new in the world of COVID. And it is something that's going to be sorted out. But you've heard some states like in New York where they're offering an Excelsior pass, which makes it easy for people to show proof of vaccination. I think many of us have our vaccine card, and I've been asked to show it a couple of times already. So again, this is a moving target, but the legal question around that, I'm not sure I can answer.
Related somewhat, if an employee says they're vaccinated, then subsequently tests COVID positive with no symptoms, can you ask for proof of vaccination?
That again, I don't know the answer of that. The likelihood that an employee who has been fully vaccinated would test positive is very low. And I don't want to pretend to be a lawyer. That is way above my pay grade. And I would suggest checking with legal counsel on that. And I have a feeling it's going to vary by state.
Some suggestions on how employers can support employees to find vaccine appointments during the workday.
Yeah, it's a great question. So there is now a central scheduling hub. I think if you remember early in the pandemic, some of you, myself included, I was scrambling to try to find vaccine appointments on like Eventbrite and all these random websites, right? Then Vaccine Finder showed up, and now finally vaccines.gov. So that is the website that will help you schedule vaccine appointments for your employees. Go to vaccines.gov. It's available in multiple languages. It makes it very easy to schedule an appointment, find the pharmacy nearest you or the location nearest you to schedule your appointments. In our resources, which I put in the chat, it also provides links to all public health departments around the country. So if you want to reach out to your local public health department, I suggest you reach out, let them know that you're a small business operating in their jurisdiction. And if you want to bring a vaccine site clinic to your work site, that's the best first step.
I do want to get back to the question that you asked on whether any of the businesses here have had successful experiences.
What I'm hearing is lots of opportunity to take some of this guidance back to your place of business. Major General Chern, I'd love to chat with you at some point offline about how we might support your work with the Retired Military Officers Association. It sounds like organizing an event like this or creating a specific workshop or session for leaders in your community might be helpful. I'd be happy to do that. Great.
I know we're coming to the top of the hour.
Stephen, I'm sending you my contact information here, okay? So you have that.
Perfect. And I'm going to just share again here, all of our resources are available on our website at healthaction.org. You can also sign up to receive our kind of weekly newsletters where we provide new resources and share events. You're welcome to add your logo to our site. We're collecting best practices from around the country, so let us know what you're up to and if any of our resources are helpful. We offer a slide deck and facilitators guide and fact sheets for different communities, as well as conversation guides to help you have workplace conversations about the vaccines, sample communications, small business resources, as well as a range of resources for employees like vaccine facts and FAQs, as well as materials in Spanish. We're organizing next Wednesday a vaccine workshop for diversity leaders and HR professionals and employee resource groups. If you'd like to join, you're more than welcome, or invite someone on your team to join. This is our session where we really provide concrete tips and tools for diverse communities to improve access as well as to respond to unique questions and concerns. So just putting that on your calendar. We're also organizing on Thursday, June 3rd, National Rural Business Summit. We know rates of vaccination in rural communities is lower than in urban areas. So we're going to focus on ways that businesses can improve access for rural communities and help educate and answer questions from communities in rural America. So that's happening on June 3rd, and you can register on our site. And I've added my email, questions@healthaction.org is a great way to email us. I have a terrific team that can answer questions in real time, so please don't hesitate to reach out anytime. And again, I just want to say thank you so much to Diego and Steve and Liz and everybody at ICIC for the opportunity to be here today, but most importantly, to thank all of you for your commitment to strengthening vaccinations and improving the health of your employees, your customers, and your communities. And on behalf of the Health Action Alliance, I'm really excited to work with you going forward. So thank you so much.
Thank you, Stephen. We look forward to seeing you in Portland pretty soon. I'm going to turn it over to our Director of Development, Liz Pugh, to close us off. Liz?
Thanks, Diego, and thank you, Stephen, and the Health Action Alliance for this wonderful presentation. It was incredibly illuminating, and I know I learned a lot. I wanted to just share, we'll be sending around the materials that you saw today, as well as the links that Stephen mentioned to some of the specific resources for small businesses. We hope you'll share those widely within your community and network. And as always, ICIC is your resource to help address these challenges with partners like Health Action Alliance. So thank you once again for being here, spending an hour with us.
And let us know when you come to Provincetown.
I will.
When you come to Provincetown, we may be, listen, well, for all I know, you may connect with us. Some of us are down around that area, but let us know for sure.
I absolutely will. And Lynn and Annette, I'm going to see you on the beautiful islands of Hawaii soon.
All right. Well, take care, everyone, and stay safe. Thank you.
Thanks, everyone. Bye-bye.